your future is not known, it's frightening. You don't know how to feel, you don't know how to react, you're kind of numb, you're kind of in shock. But once that numbness and everything wears off, you get in a warrior mode and slip on those boxing gloves and get back in the ring and kick the crap out of the Grim Reaper. That's kind of what you gotta do. Started my journey at 3.5 months old, that transitioned over to hydrocephalus at 5, and then seizures at 7, and being diagnosed with a brain tumor at 10 years old.
When I met Jessica, she had metastatic disease in her lungs. She had no standard treatment options, and if she had been seen in many other places, she may have been told, well, there's no treatment for what you have at this point in your disease.
You may take your claim on my frail outer shell, but never on my spirit that cries out, you do not own me. I own myself, and I will survive.
So the Baines Center is unique because what it aims to do is to put scientists with different specialties all in the same area and very close to the infrastructure that we need to run clinical trials.
Our goal with the tools that we're developing is to be able to help doctors to diagnose cancer earlier and more accurately, and be able to track over time the success or failure of that treatment so that they can pivot to other treatments as needed as we go.
Well, we feel we're right at the cusp of a big wave in medicine where AI is going to change a lot about what we do. What we've been doing at the Baines Center is using AI for image analysis, for analysis of pathology slides, to see if we can help our radiologists do better when they look at a CT scan.
And physicians are bombarded with this information, so we develop artificially intelligent tools, almost like a partner, that help them to read and interpret those images and come up with recommendations that they will, of course, decide between themselves and the patient what's going to be best, but the AI tools help with that recommendation.
Once we treated those areas in her lungs, they actually shrank. She doesn't have any side effects from the radiation that she got, but she did get some benefit from it, and part of that is pain improvement, and part of that is being able to see the disease shrink on imaging and on her scans. You know, I think almost everything that we've done at the Baines Center has been supported in some way by donor funding.
What it does is it gives us a massive head start on everybody else. If we have a research idea, funding is not a barrier, and with our clinical research unit, we can start it almost immediately.
Your donation is giving someone a second chance. That's what that is doing. It's giving someone a chance to go home and hug their kids, have another day to make memories, and just live life. It's so significant, and I would not be here without it.
We really want to give the physicians the tools that they need to make them successful, and give that family that extra month, that extra day, that extra year of life with their family member, and to be able to make cancer a treatable disease rather than a fatal disease.
I'm just eternally forever grateful to the Baines Center for giving me the opportunity to be able to wake up every day and make the most out of my days and fight. You always got to keep the attitude that no matter how hard it is, you reach up, you grab that balloon and you pull it back on and hold on for dear life and fight like hell.